to PCOM Perspectives. I'm your host, Dr. Jay Feldstein, and today I'm joined by Dr. Art Sesso. Dr. Sesso is Interim Dean of the Doctor of Osteopathic Medicine program at PCOM, Senior Associate Dean of Osteopathic Curricula Innovation and Accountability, Director of Graduate Medical Education for Surgical Services, and Medical Director of the Clinical Learning and Assessment Center. Dr. Sesso has taught at the college since 1986 and has chaired the Department of Surgery for the last 17 years. Dr. Sesso is board certified in general surgery and a 1981 graduate of PCOM. Under Dr. Sesso's direction, PCOM recently established a first-in-the-nation Medical Education Center of Excellence, or MECOE, to strengthen the college's ability to prepare the next generation of osteopathic physicians. Today, Dr. Sesso and I will discuss the origins of MECOE and what it hopes to achieve in the long term for PCOM. Welcome, Dr. Sesso.
Good morning. Thank you.
It's a pleasure to have you here today. And Dr. Sesso is also a fellow classmate of mine from the class of 1981. So, Dr. Sesso, where did the idea for MECOE come from? And what was the process like to make it a reality?
So, Center of Excellences are not something new in medicine. They have been involved in all kinds of aspects of surgery. There are hernia clinics, there are bariatric clinics, and so forth. And the concept originates from the fact that if you do something repetitively, and if you constantly refine the way you do it, you can do it faster, better, more economically, and the result comes out to be more consistent. And so applying that same type of concept to education seemed to be seemed to be something that should produce tremendous benefits for us. And so that's where the concept really stems from. Applying it to education, though, had certain difficulties, especially the uniqueness of PCOM and the culture that had been ingrained here for years and years and years, because MECOE was really designed to not only refine the process, but to invent new ways to do things. And that's what we're striving to do now.
In your experience as a dean and faculty member, what are some of the biggest challenges you're hoping MECOE will help address?
Well, MECOE has a lot of challenges because most of medical education today has numerous challenges. First of all, rotations and the concept that we know about rotations. All medical schools must have a certain amount of clinical experience. And yet we've all defined our clinical experiences in a way that's been the same for the last 30 or 40 years. That has to change. There are only so many clinical experiences available to all schools. Ours is no exception. And so the concept of how we train in the clinics has to be adjusted. Maybe it's going to be a combination of clinical experience and simulated experience. Maybe the number of rotations changes, but that's a huge challenge for MECOE. MECOE also has the challenge of improving board scores. Board scores have come to be, unfortunately, such an important part of the acquisition of additional training for medical students. Whether you get a residency or not is sometimes totally dependent on a board score. And how to get those good board scores, how to train a student so that he's capable of achieving a good score in a sort of a review test like that is really a difficult concept. But most importantly, it's the way we teach our medical education now. We are based our education on a Flexner model of training. Flexner model is 2 years of didactic information, basic science, 2 years of clinical medicine. That no longer applies in this world that we have today. And so MECOE will take us into the next generation of training for medical students. And maybe that concept will be 18 months of basic science and more clinical medicine. Or maybe it will be no didactic learning in a classroom form. Maybe it'll all be active learning. But MECOE will meet those challenges as they are now presented to us.
As the health landscape continues to change and our graduating students enter a healthcare field that is as uncertain as it's ever been, the training for health professionals has to adapt. MECOE is built off a model of innovation. What can incoming students expect from their experience at PCOM?
I think that PCOM is going to be in the forefront of medical education. PCOM will adjust to the new environment that we have by probably inserting more clinical medicine into the early years of training. I think a new medical student coming to PCOM today will find himself to be talking about differential diagnoses, talking about physical examination from a much earlier stage than my generation ever did. I think that this blending of basic science and clinical medicine will allow the very abstract concepts of basic science to be hung on the very concrete concepts of physical examination and clinical medicine. I think that's going to be something new. I think our students are not going to find themselves in big classrooms anymore. I think they're going to find themselves in small groups, one-on-one with a professor, and their examinations won't be the traditional examinations where you have the multiple choice exams. There will be discussions that they have with their small group facilitator. And based on their knowledge that is perceived in those small groups, that's how they'll generate their grade. So I think many, many new things are facing the students that come to PCOM in the very near term.
Well, I'm sure you've got a couple questions for me.
Absolutely. Health equity is a growing topic of discussion and one that will only continue to grow as disparities in quality of access to care increase and widen. From a curricular standpoint, we have worked to address these issues with MECOE, but what can we as a college do to reduce the inequities we see in our communities?
Well, when you look at the total picture of disparities in quality and access, I think we're trying to address those from a community perspective on all fronts. We've started the community wellness initiative, where by having events out in the community, we can do more screening, we can help to get people access to care, whether it's for hypertension or for diabetes or for musculoskeletal disorders, so that we can funnel them into the healthcare system. From a primary care delivery standpoint, we're trying to address those in the actual healthcare centers themselves. We're really working hard towards food insecurity. We've established food banks at all of our healthcare centers because we know that nutrition is a primary driver for healthcare. And we can only do so much. We know that generally poverty is a major driver, education is a major driver, and housing as well. So we're doing the best we can. Can we do more? Sure. But we really need to be a community-focused entity, not just from a classic healthcare primary care delivery standpoint, but we really need to address these as a society in general.
From an admissions perspective, PCOM has to continue to develop ways to attract new students and remain relevant for an evolving medical field. As an administrator, what do you see as the biggest challenge in accomplishing that goal?
I see that as a twofold challenge. One is that we have a very diverse society, and we need to have a student body that reflects society so that patients will see physicians and healthcare providers that look like themselves. So we have to continue to be committed to diversity in accepting our student body, as well as diversity in our faculty and our staff. Part two of that is making sure that we have the tools in place from a retention standpoint, that the student body that we admit today is successful, completes their graduate medical education degree, and is able to achieve success in the marketplace, whether that's through attaining a residency of choice or through a job, whether they're physician's assistant, physical therapist, or psychologist.
Thank you. The environment for graduate medical education institutions is highly competitive. How do you think PCOM can continue to keep pace with our peers, both osteopathic and allopathic?
Well, Dr. Sesso, I think that falls back on you.
That's why we have
that's why we have MECOE, to make sure that we're turning out the best product we can so they can be competitive in their residencies through their education. At the end of the day, like you said, to be competitive in this environment for graduate medical education, it's board scores, it's performance on rotations, it's performance in the undergraduate career, in their undergraduate education, in the clinical years, and it's really measuring their success. We need to have objective measures of success so that they can be competitive in the marketplace for the residencies of their choice. And I know you're committed to research. Research is a big component of residencies today, especially in the surgical subspecialties. And we just need to be committed to student success, because at the end of the day, without a successful student outcome, we will cease to exist.
Totally agree. Thank you.
Well, Dr. Sesso, thank you for joining us today. Adapting to a rapidly evolving healthcare landscape and preparing our students for success beyond our walls is a constant challenge. But with innovative approaches like the Medical Education Center of Excellence, spearheaded by Dr. Sesso, a model has been established for PCOM to compete well into the future. To listen to past episodes of this podcast and become a subscriber, visit our SoundCloud page or find us on iTunes by searching Philadelphia College of Osteopathic Medicine. I'm Dr. Jay Feldstein, and this has been PCOM Perspectives.